Good morning, everyone. Thank you so much for joining us this morning. We're excited to have you in this space today. We know that you all are calling in or Zooming into this webinar from different places all over the state. So again, we just really appreciate you joining us this morning as we are sharing some information about the American Rescue Plan Act dollars and how these dollars can be distributed more effectively, efficiently, and more equitably in our state. So this is our presentation, Your Voice Matters, Advocating for Community Health and Racial Equity, the American Rescue Plan. Next slide.
Sorry, it's going a little slow. 1 moment.
No worries. So as Holden is shifting slides, I'll just get started in sharing a little bit about us. So of course, we are public health advocates. This is an initiative, California COVID Justice. It's a coordinated public health response to the deeply rooted inequities that we've been experiencing from COVID-19. So this initiative was started to address those issues, looking both immediately and intermittently and then long-term on how we can address and repair the issues that we've seen in regards to COVID-19. So this initiative is led by a coalition of public health leaders, and this initiative works to dismantle systems and structures that have put historically underinvested communities and people of color at greater risk for adverse health outcomes, not just because of COVID-19, but also, of course, COVID-19 has illuminated the issues that we've experienced due to the pandemic, but we're also fighting to disrupt and dismantle those longstanding systems and structures that have continuously impacted people of color long-term. And so by advocating for the needs of for needed policies, programs, and resources, we push to strengthen the public health infrastructure by including laboratories, health orders, and a diverse workforce. We also are looking to address racism as a public health crisis and establish health equity through new policies and equitable funding framework, as well as increase the supply of adequate and affordable housing with support services to prevent the growing number of Californians who are experiencing homelessness. And so our priorities and strategies are informed by the steering committee, and the committee members are a partnership to public health advocates. And we are super excited to roll out this initiative and begin to advocate for the well-needed issues that we've been experiencing due to the pandemic. So we put this presentation together as a tool to help support communities advocate for the resources needed as they respond to and recover from COVID-19. And the American Rescue Plan Act is sending billions of dollars across the country and to California's cities and counties. And so we really want people to have this information so that they can share with their local networks and begin to advocate locally for how these dollars are going to be spent locally for their nonprofit organizations, communities, those who are most directly impacted by the pandemic. So how to use this information. It's important that community members that are directly impacted by the pandemic begin to advocate for things such as community members to be a key part in setting priorities for developing spending plans. So making sure that we're talking to our local leaders, our local government officials, and helping them set the necessary priorities on how these dollars are going to be spent, and ensuring that they're being transparent in how these dollars are going to be spent. Oftentimes we're not really seeing that across the state, particularly when it came to the CARES dollars, right? There were a lot of issues that were lifted up and how those dollars were spent or not spent to support families, those most impacted by the pandemic. So we want to make sure that the investments in public health programs, that there's investment in public health programs and infrastructure, as well as direct payments to families, as well as our investments into our nonprofit organizations. And then also directing money and resources, again, to those most impacted by the pandemic. So what is the ARPA? So the American Rescue Plan Act was instituted on March 11, 2021. So President Biden signed into law the ARPA, which was a $1.9 trillion coronavirus relief package. And so this package included $350 billion in funding to state and local governments for fiscal recovery. And so the funds were distributed to the states as early as, I believe, early in May, the dollars began to trickle into states in certain territories. And that's based on a formula that considers that states shared a share of the unemployment rate. And so the American Rescue Plan Act, it basically was to deliver immediate and economic help to American families most impacted by the pandemic. Primarily, we're hoping that relief goes to low income and people of color, again, most impacted. And through the ARPA, the state's California will receive $26 billion to our cities and county. And so your voice is truly needed to make sure that this money goes where it's needed most. And community members and CBOs can influence where this money is spent, particularly as we're discussing issues around our public health infrastructure. It's important to note that our public health infrastructure provides our communities, states, and our nation with the capacity to prevent and promote health and prepare to respond to both the acute emergency issues and the ongoing long-term challenges that things such as COVID-19 have laid bare. And so public health infrastructure provides that necessary foundation for undertaking the basic responsibilities of public health. And so we want to make sure that, again, these dollars are going to directly to address issues such as our public health infrastructure. So a brief overview of the funding. And so hopefully you all can see this image. I know it's a little small, but the ARPA distributes money to a wide variety of sources, including childcare, education, health services, and forms of direct assistance, such as stimulus checks that many of us have seen go out earlier this year. And then also, we'll be focusing in this presentation specifically on state and local recovery funds. And that includes $16 billion for California cities and counties, because these funds are flexible. You have an opportunity to advocate, again, where these dollars go. So here's where we get into the important pieces, right? So we want to really understand how local dollars can be spent. And so the $16 billion in federal aid that's going to California's local governments, including our cities and counties, can be spent on things such as responding to public health emergencies, again, COVID-19 and its economic impacts, providing government services where there have been a loss in funding, investing in water, sewer, or broadband infrastructure, as well as assisting essential workers and those who are on the ground level and providing them with premium pay above their base wages. And so we've seen that many of those who have been affected by the pandemic are not making a livable wage. So we want to make sure that these dollars are investing in those who were most vulnerable or susceptible to the pandemic because they were essential workers and they kept this country going during the pandemic. So the local government, how local funding works, the local government can spend the dollars on its own programs, or it can transfer funds to a nonprofit or other community-based organizations for approved projects. And that's important to know because, again, our nonprofits, many of them were ground level and first responders to the pandemic. And so we want to make sure that investments are going to those nonprofits to determine where those dollars can be most useful for our communities. And so again, your advocacy is crucial. Community members and government and community councils and community-based organizations can and should advocate for how these dollars need to be spent. And so again, it's important to make sure that we are leaning in right now because the dollars are trickling into local municipalities. And so, we need to be contacting our local government officials so that we can begin to advocate or continue to advocate and hold them accountable for where these dollars go. So a couple of facts about, how all of this has impacted, how the pandemic has impacted those most people of color. Job loss, of course, has disproportionately affected people of color throughout the pandemic, specifically those who identify as Black and Hispanic. And of the estimated 161,000 unhoused people in California, 40% are Black Americans. And so again, we're lifting up the issue that racism is a public health crisis. Job loss specifically has been an issue, right? And so investment in the public money to local governments to make sure that that money goes to low wage workers, communities of color, those who are essential workers, that's a necessary step forward. So we got to make sure that, again, that these dollars are going to those who have been most impacted by the pandemic, looking at these statistics, looking at the data and using that as our litmus to determine where investments need to be made. So part of what we wanted to do with this presentation is not just talk about, how to use the dollars, but also provide some recommendations. And so in California, COVID Justice Coalition recommends that we use the $16 billion in local funding towards critical supports, such as economic supports, housing, racial equity, and public health infrastructure. And so these are part of our priority areas that the steering committee has identified. And we do this, we've made these decisions using a racial justice lens. So again, we're looking at those who have been most disproportionately impacted. And so when we're talking about things such as investing in economic supports, we're lifting up issues such as economic assistance, so providing direct economic support to individuals and families in need. And we can use the American Rescue Plan Act dollars to do this. And so this can be done by using cash payments, job training, and job placement. So it's not just not just direct payment, but also looking at how are we making sure that we are repairing the job loss that occurred during the pandemic by making sure folks get trained or replaced in jobs so that they can sustain their household and support their families. And when we look at racial justice or lifting up racial equity, we want to make sure that we constantly are naming racism as a public health crisis and establishing health equity through new policies and equitable funding. And this can be done through funding partners to help with COVID outreach, vaccine access, language access, doing that through a culturally responsive lens, identifying those nonprofit organizations who are trusted messengers in our communities, and investing strategically in those organizations who have been first responders and at the ground level supporting families and pivoting their services during the pandemic. Also addressing housing and homelessness. So increasing the supply of affordable housing. We know that that's an issue across California, specifically in our most concentrated cities. And so we want to make sure that those Californians, specifically Black Americans and Hispanic Americans that are experiencing homelessness are assisted through programs that can help them either regain housing or sustain housing, or even long-term looking at how to make sure that these individuals are able to purchase homes to prevent issues of homelessness in the future. And so again, looking at rental assistance, mortgage debt relief, again, or permanent supportive housing. And then lastly, public health infrastructure. So strengthening our public health infrastructure to make sure that we have the supports in place, not only to respond to emergencies, but to mitigate emergencies due to pandemics long term. And so here's some specific ideas on how you can spend the money in your community. So again, we talked about direct economic supports to families. So creating pilot programs to provide guaranteed income to historically underinvested communities. And guaranteed income is the idea of providing a set amount of money each month to ease the stressors of poverty that make it harder for people to find work, stay healthy, or even pay for childcare. And so there are some example programs out there in Stockton, Oakland, and San Francisco, to name a few. I think Los Angeles has a few examples of this as well. But one being in Stockton is the SEED program. And this was the nation's first mayor-led guaranteed income demonstration. And it was launched in 2019 by former Mayor Michael Tubbs. And this program gave 125 randomly selected residents $500 a month for 24 months. And the cash was unconditional with no strings attached, no work requirements. And the goal was to make sure that this was an innovative solution to poverty and inequity. And so the preliminary findings of this program showed how just $500 a month provided support, dignity, and agency to these families that were in need and most impacted by the pandemic. So these are just some examples of things that we can do to mitigate the ongoing issues that the pandemic has lifted up. Another example is the grants reparations programs. And so reparation programs are a small way to recognize the historical inequities that Black Americans have internalized and experienced. And so, reparations can be in direct forms that underscore racial disparities in health, housing, and also in entrepreneurship. An example of this is a program in Evanston, Illinois, where the city got behind a restorative housing program. And so this was one of the first reparations initiative. And this initiative aimed to revitalize and preserve home ownership of Black Americans in Evanston, also increase home ownership by investing in Black Americans who were interested in purchasing housing or houses, also improving the retention rate of homeowners by making sure that they're getting quality loans and quality funding for their housing. So these are other small ways to support through direct economic supports for families. And so, supporting initiatives such as home ownership, mortgage assistance, even home improvement oftentimes can be a way to mitigate housing issues. And so these are, again, other examples of how we can invest in our families, in our communities, to make sure that there is repair for the pandemic and the long-term systemic issues that we've experienced in this country. And so questions to consider as you're advocating or even exploring ideas with your community are what programs can be put in place or expanded to support immigrants and small businesses owned and operated by people of color in your community? And also, how can guaranteed income programs help to support families in your community? And so again, some of the examples that we lifted up are example programs that can be put in place, but you also want to see, as you're exploring these ideas with your community members and your constituents, what are the issues that are most relevant and pertinent to them in their community, and then figuring out how we can design or even support programs that are already in place. And so our other priority area is housing and homelessness. And again, so we're looking at investing in permanent supportive housing solutions, not responding to crisis, but how do we make sure that these dollars go into permanent solutions that can sustain our housing, the housing crisis that or not sustain the housing crisis, but how do we make sure that we invest in permanent supportive housing for our families and communities? How do we make sure that we create safe and organized spaces with wraparound services for unhoused people? And funding adequate affordable housing and access to income-based housing, and cancel or defer rent and mortgages for those who were impacted economically through the pandemic, and providing grants for home ownership. Those are some examples as well. And so questions to consider. Who doesn't have housing and who's at risk of being homeless? Is there a housing shortage in your community or your city? And what programs can help prevent homelessness? Are there existing programs in your city or county that we can support or invest in? Or are there programs that need to be created because you don't have them? And how can your community use the ARPA funds to provide shelter for people and families who are homeless? And so these, again, are some questions to consider as you're advocating in your communities. So I'm going to toss it over to Dr. Flo, and she's going to talk about racism as a public health crisis and some of the strategies that we can look at both intermittently and long-term to mitigate this in the future.
Well, good morning, everyone. It's really a pleasure to be with you. And I'm going to now talk about racism as a public health crisis. One of the things that you've probably been hearing is this phrase, racism as a public health crisis. And throughout California, there are lots of cities right now, 29 cities and counties that have declared racism a public health crisis. And so what that means is that we're acknowledging that racism, its historical and ongoing underpinnings, are changing the way that our communities are structured and limiting access, limiting opportunity, and having really tangible impact on people's lived experiences, including their health and wellness. And so what we saw during the pandemic is that our communities of color have had the highest rates of COVID illness and death. They've been the most impacted. And this is when we're talking about our Latino communities, our Black, our Native American communities, our immigrant communities, and even our low-income communities. And this is all incredibly predictable and expected based on the systemic patterns that we've seen. They were exposed to extreme inequities, because their communities have been underinvested. And so what declaring racism as a public health crisis means is that we have to make some long-term investments to ensure that there are advancements in equity, that we're removing those barriers and we're removing the challenges that exist in people's lives to being able to experience the health and wellness that we'd like to see. And so the American Rescue Plan Act funds really should be spent towards some inclusive and accessible and equitable recovery efforts. We have to invest in them because this is how we dismantle these long-term disparities. And so when we declare racism a public health crisis, we have to couple that also with addressing the root causes and acknowledging that there is a broken system that was not designed for the advancement of everyone. And so this is really important as we look at these numbers because this has an impact on where we should move and how we should invest the recovery dollars. We need to be responsive to the problems that have been illuminated during this crisis. Next slide, please. So when we're talking about investing in racial equity, we're talking about how we can spend these dollars that are coming to cities and counties. And I emphasize the cities and counties because this is a place where we can get hyper local, where we can think about neighborhoods and communities. And we can even think about, if you're talking about county money, cities, right? And regional areas that have a certain culture and have really specific needs, those needs that can be targeted and can be addressed by these dollars. And so one of the questions that came up in the chat, and I saw Natalie was asking, is like, can these dollars be targeted to the people who were harmed? And the answer to that is yes. I know sometimes because of Prop 209 in California, that people are concerned about whether or not they can specifically target impacted communities. But Prop 209 really only prohibits state institutions from considering race, ethnicity, and sex in public employment, contracting, or education. It does not prevent you from being able to make investments as it relates to health and wellness and other ways of investing in communities. And so it's sometimes incorrectly identified as being a barrier to being able to provide resources to communities of color, and that is absolutely false. And I'm just going to give you a few examples of some programs that already exist in California that have in some instances been put in place since the start of Prop 209 that fly in the face of people's misunderstanding about this barrier. One is the Black Infant Health Program. It's a state-run program that also has local work that's happening around the state to be able to address the disparities in infant outcomes in the Black community. Another one is the Oakland Black Business Fund. So those are examples that are serving Black Californians. And right now, California is taking applications for $125 million in public and private disaster relief funds for California workers without permanent legal status. So this is an example of a program that's primarily designed to target Latino and other immigrant populations. And so we have to recognize that, yes, there are lots of programs and policies that have been put in place to be able to serve communities. And so we should not see that as a barrier or view Prop 209 as not allowing us to be able to do the things that we sometimes feel we need to do to be able to address these disparities. There also are, our federal outreach dollars that have been targeted to farmers and ranchers and other folks, predominantly serving certain communities. And so we need to make sure that we just understand what are and are not allowed and what activities are and are not allowed when it comes to investing in racial equity. Next slide, please. So when we're thinking about economics, right? One of the challenges here is that we're dealing with racial disparities, and when we've looked at how this pandemic has played out, it hasn't just shown up in the ways in which people contract the virus. It's also showed up in the ways in which their lives have been impacted. So if we think about wealth gaps, and that being just the foundation on which this pandemic was laid, that there were already wealth gaps in terms of small businesses, that especially those that were minority owned. There were already wealth gaps in terms of just personal finance and how much money people had available to them if an emergency happened. And so when layoffs began, when certain workers were deemed essential workers, there was a racial disparity in who those workers were, who those frontline workers were, and they were often disproportionately people of color, thinking about nursing and agriculture and retail and the food industry. And so they were both at highest risk of COVID because they were exposed in the beginning and didn't necessarily have all the personal protective equipment that was necessary. They also continued to be required to go outside of the home to work, even as shelter in place orders were put forward. And they were also, in some instances, for depending on what those the food industry, they were also most likely to be laid off or have their hours cut, which had a financial impact on these communities. And so these ARPA funds can be used to provide hazard pay for essential workers. That can even be done retroactively to be able to compensate for some of the pay that wasn't provided at the peak of the pandemic, and also can be used to raise the minimum wage to be livable so we can reduce poverty rates for people of color, as well as supporting the businesses and being able to make sure those businesses can stay open as we are moving through the recovery period for the pandemic. Next slide, please. And so as we begin to think about, how this plays out in strengthening the public health infrastructure, I want to first define public health infrastructure because that's kind of wonky and it's not something that's readily accessible to people. So when we're talking about public health, we're not just talking about healthcare. Healthcare is one aspect of public health, but public health is all of the things that are happening as you move through your day. It's the quality of the air that you breathe and the water that you drink. It's whether or not there are safety regulations in place to be able to protect you when you're working or when you're moving about in a community. And so public health, infrastructure is basically that public infrastructure that exists that we support with public dollars to be able to prepare for and respond to threats to our health and wellness. And so when we invest in that infrastructure, it makes it so that we are able to stay healthy and that when issues come up, we're able to do some prevention to make sure that as few people as possible are harmed. And what we saw during this pandemic is that the public health infrastructure had been eroded from 2008 and even before in terms of health departments just being significantly under-resourced. And so that left us essentially unprepared to be able to respond to this global pandemic. A lot of the dollars that we've seen come in for public health over the last 20 years have been largely tied to some infectious disease like Ebola or Zika. And then when that was considered to be resolved, those dollars went away. And so we weren't able to do the deep-seated and long-term prevention activities that are necessary to keep a community safe. And so what that ultimately ended up doing was leaving us at greatest risk. It impacts the speed of a response when an emergency happens because we have to build things in real time. It limits our ability to make plans prior to a pandemic to be able to make sure that when something happens, we can activate instead of having to build it. We don't have staff in place to be able to coordinate efforts. We weren't able to get material resources, either to have them stockpiled or when we did have them to be able to disseminate them to communities really quickly. And it means that, we work best in public health when nobody knows we exist, because it's the invisible force moving beyond to make sure that everything that you need is taken care of before you get there. And the challenge is that when the infrastructure isn't in place, we notice and we see and we better understand the role that public health plays because we're unable to play that role successfully. And according to the California Pan-Ethnic Health Network, communities of color who are becoming ill and dying at higher rates than whites are bearing the brunt of these decisions about public spending. So this is once again an example of how when we don't fund things, people suffer. And that is because it's layered on top of the existing inequities. And when we don't meet needs, the people whose needs already weren't met prior to the crisis are the ones most likely to also have new and emerging needs not be met. Next slide, please. So when we're thinking about strengthening this infrastructure, we should be able to use these dollars for exactly those purposes that we talked about. Strengthening some of the community health programs and collaboratives, the mobile health units, promotores and community health workers, street medicine clinics. All of these are ways that we can work in communities to be able to have some coordination, as well as boots on the ground people who are working for nonprofits and other community partner organizations to be able to make sure that our response is strong and that it's meeting needs, and that there's a two-way communication line between what's happening in the public sector and what's happening with the people who are in communities. We can create and strengthen task forces and community-based campaigns that are able to get communications out, especially communications in languages other than English. We have 17 languages in the state of California that are considered to be threshold languages that are spoken by at least 5% of the population. And so when we are getting messages out and we don't have materials available in those languages, we are by design systematically leaving those communities out of the conversation. And so then they get the information last because it's literally not in an accessible language. And that has an impact on how quickly we can respond and how quickly those preventive efforts can be put in place. Providing equitable and widespread vaccine distribution. We have seen this happen over and over again. There's been a lot of conversation about, vaccine willingness or lack thereof, but not a lot of conversation about vaccine access. Where did we set up the vaccine distribution centers? Did we make them mobile so that we could get to people who have disabilities or transportation limitations? How did we make sure that people were able to get the things that they needed? Was it all online, which is going to disproportionately impact our older populations and people who don't have access to technology? And that also is going to fall along economic lines. So really thinking about what the infrastructure looks like to be able to make sure that everybody gets what they need in a way that is accessible to them. And that ultimately allows us to improve outreach, education, as well as accessibility of services to our entire population, thereby decreasing the inequities that are caused by the way that we function. Next slide, please. So some questions to consider as we are thinking about racial equity in public health infrastructure are questions like, what public health needs in your community have not been addressed by the pandemic? What are you seeing specifically? Because these dollars are going to cities and counties and not to the state. So you may be seeing some patterns based on the population in your state or based on the population in your county or city. You may be seeing some patterns that are different from those in neighboring counties and cities or even statewide. So what specifically are you seeing in your communities? What existing programs can be supported with ARPA funding to improve community health? There already likely is an infrastructure in place. You've built things over the last 16 months. And so what about them needs to be strengthened and continued to make sure that whatever the next crisis is, we're already ready to be able to pivot and maneuver and be able to address that so that we don't have to lose hundreds of thousands of people before we get a good structure in place. And then what are some of the other ways that we can address racial equity? We have only scratched the surface today in talking about some of the major pressing needs that we're seeing in communities. You're going to see more of them at a local level. And so what are the places that we need to invest in to be able to address from a preventive standpoint some of the things that we've seen so that the impact if something happens in the future, whether it's a wildfire or whether it's a flood or an earthquake or another pandemic, that we're in a better place to start to begin with so that the impact of that is mitigated. Next slide, please. And so, I want to talk a little bit about sort of what the money shouldn't be spent on, because we've talked a lot about all of the opportunities for where the money can go. But the truth of the matter is, part of the reason that we're coming together to have this webinar today is because of what we saw with the CARES Act funding, which was the coronavirus relief funding last year. And we saw that throughout the state, lots of communities had the money go exactly where it's always gone, which is unfortunately to law enforcement. And in the midst of a pandemic, that's one of the places where we actually didn't need to see the money go. Many people don't know that anywhere between 30 and 75% of our municipal budgets in cities and counties already go to law enforcement in the carceral system. And so then to have our coronavirus relief funds also go to the place that is the best resourced and has not only recovered from the 2008 recession, but has actually increased since then, was a real slap in the face to people doing public health and community work. And so we want to just make it really clear that it is our our contention that ARPA funds should be used to support communities and individuals who've been devastated by the pandemic. And given that much of city and county budgets already go to law enforcement, we don't think these dollars should go to law enforcement. We think they should go to the places that are going to specifically work on prevention and response to this pandemic. And what that means is that we are going to need your advocacy support to make sure that doesn't happen, because we saw many cities and counties spend the money last year specifically on law enforcement. The California Pan-Ethnic Health Network was great about convening a lot of folks to be able to talk about what happened and think about some ways that we could begin to work on preventing that in the future. And so these dollars were intended to address the basic needs of individuals and families at the local level. And so we need advocacy support to be able to say to our decision makers, no, we don't want these monies to go to law enforcement. And here are 10, 20, 30, 50 other things that you could spend these dollars on to be maximally effective. And so we have listed out for you today public health infrastructure, support for families that are struggling economically, and addressing the housing crisis as just a few of those ways that we could spend these dollars just to get you going, but really wanting to encourage you to answer some of the questions that we posed about your individual communities and figure out what are some of the local needs that you can meet with these dollars without spending them in ways that don't quite make sense for a pandemic. And I will pass it back to April.
Thank you so much, Dr. Flo. So as we're wrapping up, we want to make sure that you all are aware of how to access your county or find your county or city's local allocation. And so this slide shows a few examples of counties or cities. And so what you see is, for example, Sacramento has both county and city government. And so the county of Sacramento is getting $303 million, and the city of Sacramento is getting $112 million. City of Roseville is getting $17.3 million. So these are just a few examples. And so embedded in this slide deck, you can click these links, and Holden or Jessica, can someone drop the links in the chat for the participants, those who want to take a look at their local county's allocation? I think there were a couple of questions in the chat about finding out what their allocations were. You can click these links, and if we have a couple of seconds, so Holden, do we want to click out and just kind of share with the participants what this screen looks like and how they can find their local allocation?
Sure. Do you want to look at county or city?
Anyone.
Okay.
So if you click the link, it's going to pop up a screen, and you see this American Rescue Plan estimated AIDS allocation by county. It's pretty simple. You'll click the drop down and pop in your county. There's a drop down that'll list it, and you click it and it'll share what your allocations are. And it's important to note that there are two payments going out. One payment went out the week of May 10th, and then payment 2 is going out May 10th, 2022. And counties, cities, and local municipalities have until 2024 to spend the dollars. Okay, so we can go back to the presentation. And so we've dropped the links in the chat for those who are asking about their specific counties or cities. Click those links and you can pop your information in to determine what your city's allocation is. Next slide. And so as you see, this is a visual just to show you all where we are in the allocation, in the American Rescue Plan implementation date. So in March, the ARPA was enacted, and in May, we're not in May anymore. We were in May when we did this, created this presentation, but in May, the allocations were beginning to trickle into the states and the cities and the counties. And so half of the funds were dispersed, and 60 days after enactment. So we're kind of a little behind the curve, right? So you know that some of your cities and counties have already received these dollars and some may not have. And so it's important to check and start to have these discussions locally with your government officials and those who are overseeing ARPA dollars to determine if those dollars have trickled into your city yet. And so again, May 2022, the second half of those dollars will trickle into those local governments or local cities and counties. And then in May 2024, all funds must be spent. And so we have some time, but at the same time, we don't want to wait until, the dollars are there to begin advocating. We want to do that now. And so we'll talk a tad bit about what that can look like on the next slide. And so again, what can you do now? So speak with your decision makers. Again, begin to contact your board of supervisors, city councils, the mayor, anyone who has some decision-making authority in your county or your city. Speak directly, attend those meetings and speak during public comments. Begin to ask questions about the ARPA dollars and how the county or the city is planning to spend them. Identify programs in your community that can be expanded. So have those conversations. If you don't have coalitions already, begin to build coalitions amongst like-minded individuals or even like-minded organizations. So you all can begin to advocate and build power in your city or county to address this at a larger level. And begin to organize around this. This toolkit and slide deck will be shared out after our second webinar on Thursday, and we'll talk a little bit more about that on the next slide. But you can use this to begin to guide your conversations in your city or county right now. And begin to demand a community-driven process. I think, again, as Dr. Flo stated during her segment, we've seen during the CARES Act that a lot of those dollars were spent, decisions were made behind the scenes, behind the curtain, and they did not involve community input. And so we're demanding at this point that community is involved in this decision-making process. And so we have to make sure that we do that in a way that's going to be effective. So making sure that those priorities are reflective of our community needs. Now is time. We can't do this. We can't continue to allow our government decision makers to, make decisions behind the veil. And so it's important for us to get out there and start having these dialogues now. And also ask for reports on where the money is being spent. This is public record. And so we have the right to have access to that information. And so, make sure that we're asking for those reports so that we are informed on how those dollars are being spent and making sure that it's in alignment with the community's priorities. And then again, making sure that those documents are accessible and not just in English, but making sure that we're doing that in a lens that's culturally responsive and linguistically responsive, and making sure that this information is going to all of the community members so that they are all informed on how these dollars are going to be spent, and being clear that they're going to the communities and the neighborhoods that are most impacted by this pandemic. Next slide. So what's next? So the California COVID Justice Steering Committee is creating more advocacy tools. And so a recording of this webinar, the slide deck, as well as additional advocacy tools will be up on our website. The recording of the webinar and the slide deck and a talking point toolkit will be up by the end of day on Thursday. So you can begin sharing that and using that as early as Thursday. And then we'll have additional advocacy tools. Thank you for those who dropped some questions in the chat about certain resources that we can also include in that toolkit. We will make sure that we get that information to you all as well. So continue to look out for those tools. We will drop the link to our American Rescue Plan Act page so that you can save it, bookmark it, continue to follow us, and make sure that you're prepared to download those documents when they're available on our website. Right, so that concludes our presentation on the American Rescue Plan Act. So we will take some questions. I think there are some questions in the Q&A and also in the chat. So I will toss it to Jessica to lob Dr. Flo and I some questions. I think we have about 11 minutes.
Thanks. Okay, so our first question comes from Shirin. Can you comment about how effective the California League of Cities has been, is anticipated to be with their technical assistance to cities? How strong of a racial equity orientation does the League bring to their work with members?
That's a great question. So we do have the League of Cities as one of our strong partners. And so as of right now, we know that they are sharing information about the opportunity for the cities as their members and talking about the ways in which these dollars can be spent and what the opportunities are going to be. In terms of the racial equity orientation, that is something that we know the league is interested in, but not really sure about their internal capacity to be able to work with all of the cities on that. And so I think that's an opportunity for us to be able to think about what working with them might look like to be able to increase that. So it's a really great question. And it's one where I would say probably in the preliminary stages, because that hasn't traditionally been the focus of that organization in terms of thinking about how cities engage.
So in the interest of time, I'm going to select a shorter question also. 1 second, please. From Vince, should a guaranteed income program be administered by county, city, or nonprofit? Also, how might a guaranteed income be implemented for cities with a population of 50,000 or less? According to ARPA, funds will flow through the state or smaller cities. Thank you.
I would say that that's the answer to that question is a locally determined one. We do know that the guaranteed income program, the state is interested in looking at a guaranteed income program as well. And so that's one of the things that the governor has expressed interest in exploring, but also that these ARP dollars, if they're coming to the county or to the city, that you can advocate for that. So I think the structure of that, how it's set up, is entirely up to the local community members. And so we would not want to step in and advocate for one or the other. It may make sense depending on how your city or county is structured or what your nonprofit infrastructure looks like for you to do it in a variety of different ways. And so I would suggest looking at the Stockton pilot and some of the other pilots where this has been tried around the country to be able to see what might make sense and consider the local conditions in answering that question.
We have a longer question, but I'm going to do part of it. I would appreciate any suggestions you have about advocating for county representatives to leverage state funds to preserve ARPA funds, ensuring they do not spend the ARPA funds on programs and services that the state is going to already provide funding for. And this is from an anonymous person.
It's another great question. It's interesting. Dr. Flo, do you want to share a little bit about the people's budget and for those that may not know and how that came about? Because that could be another strong example of how we can hold governments accountable.
Sure. The People's Budget, so we, Public Health Advocates, is a part of the People's Budget Sacramento, but the People's Budget was actually started in Los Angeles, and it is a project of Black Lives Matter Los Angeles, and there are several People's Budgets around the state that are, and around the country actually, that are working on addressing budget equity and budget justice. And so looking at how budgets are spent and trying to, as a primary aim, just make it much more simple, because there's a lot of policy advocacy happening, but when it comes to budgets, a lot less so, because budgets are hard to understand, and these like 500 and 600 page documents are just dropped on websites without a lot of explanation or understanding for lay people to be able to jump in. And so part of what the People's Budgets are trying to do is just get people involved by breaking down the language and identifying the opportunities to be able to weigh in. And so I think that's the spirit of this webinar and the work that we're doing right now is really in that same vein of how do we take that idea of getting more people involved and use it to be able to hold people accountable. We, as in working in Sacramento, when we got involved, there was a coalition that was that the People's Budget was involved in that was looking at the CARES Act dollars. And by the time we got any transparency from the county, they had already spent 85% of the CARES Act dollars on law enforcement. But luckily, because of advocacy, $45 million were able to be, retrieved from that allocation and be spent on public health. And so that's an example of the importance of your advocacy efforts. And so a lot of it is putting pressure on your elected officials to pay attention to the dollars that have come into the state that could be, that are already going to be spent in certain ways, and making sure we leverage those opportunities and do matching funds, and that we're enhancing those dollars at the local level instead of trying to supplant or compete with them. And so unfortunately, but also fortunately, the opportunity is ours, but it also means the responsibility is ours as external entities to be able to let our will be known and share with the people who are in leadership positions what we'd like to see happen, and make it so that there is political will around doing it and political pressure to advance those ideas and to look into coordination.
Our next question is from Julie Hernandez. Ideas on how cities can spend funds on public health when most public health departments are located in county structures.
Yeah, so the suggestion about public health was largely one that was targeted towards the county dollars, because we know everybody in California is living, in a county of some sort, and so that's one that everybody can rally around. But there are public health opportunities in cities. There's just not the opportunity to coordinate the services in the direct way. So cities still can be involved in housing and homelessness. Cities still can be involved in supporting small businesses and doing economic supports, and all of those things are public health. And so it's true that public health services are housed by the county, but it's also true that a lot of what we sometimes refer to as the social determinants of health, so the ways in which our lived experiences are shaped that have health outcomes associated with them, are under the direct purview of the cities. And there's a lot of opportunity for the cities to be able to support the jobs and the economic pieces and some of the other things that we've identified that are definitely in the public health wheelhouse as well.
2 more questions. Do we have technical assistance available to combat narratives with local jurisdictions making deep investments in policing?
That is part of what's coming in the advocacy tools, are some talking points around how to develop your advocacy strategies and what you can use to be able to combat some of the dominant narratives around where these dollars should go, and being able to explain why we'd like to see these investments happen in a more equitable and just way. So stay tuned to that phadvocates.org/ARPA link, and more resources will be available there, including some communications talking points.
Last question. Is there a no supplementation clause? For example, don't use the funds to fill in things already in government budgets.
Yes, is the short answer.
Yep.
But the challenge is that it's very easy to make an argument that this is new spending related to the pandemic. And so that's actually what has happened, what happened with some of the places that spent their money on, their CARES money on law enforcement, was that they made the argument that their law enforcement agencies had additional responsibilities due to COVID, and that this wasn't supplanting funding, this was new funding.
All right. Was that the last question, Jessica?
Yeah, I got one more in the chat. Can you provide a draft letter to city government in the toolkit?
That's
that's actually something that we will be including in the toolkit, is some language that you can share with, to write to your local city governments, county governments. We'll also have a model resolution and a few other tools that we think will be really useful for your advocacy efforts. Mock survey questions, we'll have some fact sheets, as well as even a model racial equity framework for decision making, and how to make sure that we're considering race and the impacts of not considering that as we're allocating these budgets or allocating these dollars. So it's a great question.
And I got one last question in the chat before we wrap up. From Kate, use for computers and internet for community members. So I believe that the question is around ARPA and broadband infrastructure.
Yeah, so there is a specific call out in the ARPA around broadband infrastructure. And so I'm certain that will consider use for computers and internet and accessibility, and making sure that internet computers are accessible for all community members to have broadband access.
Yeah, so I believe that's it.
All right.
So
great. Well, thank you all for attending today. Please be on the lookout for the additional tools.